All right, Len, if you're here, hop on, let us know. We'd love to chat with you. All right, let's get started. We're going to talk about our Medical Monday post. So if you've been diagnosed with an aortic aneurysm, you might have a ton of questions, some concerns about this condition and your treatment options. And here are some questions that really will help you ask your physician, help you communicate about this condition, help you understand what's going on when it comes to your situation. So one of the first things you should ask is, what is an aortic aneurysm, right? Let's understand what it is and what actually causes it. That might help you get a better sense of, I think as humans, one of the first things we say to ourselves is, did I cause this? Did I, eat something really bad and now I've caused this situation that I'm trying to understand? So it's important for you to understand that probably this is hereditary, and maybe you've just had the bad genes, and it's just something that was going to happen, and for whatever reason it got turned on. It could be that you didn't know you had high blood pressure. I mean, because so many people walk around and they just don't know, and that was a contributing factor. So asking, explain to me, what is it, and and how did I get it, I think will really start that conversation going a lot easier. I think it's also important to ask, how big is this aneurysm and where is it located? Now, when you ask the question about how big is the aneurysm, you're asking something that you don't really understand what that means in relation to your actual overall aorta. So remember that you're going to hear a number, and I think it's it's very common for all of us just to hear this arbitrary number and get a little nervous. So I'll give you an example. So I didn't have that opportunity because I had a dissection, but not too long ago I had a cardiac catheterization, and they came back and they said, "Oh, your vessels are great, your heart is great. You have a 40% blockage in your coronary artery, and everything's fine." And I went stone cold white because 40% kind of sounds a little big to me. But then they explained to me, I'm 54, it took you 54 years to get to this point of it being 40%. And we don't intervene till it hits 80%. So technically, I suppose if I implemented no changes, it could take me another 54 years, right, to get to the 80%. But I had to kind of understand, how do they even make that judgment? They just kind of eyeball it, and they're so used to seeing this every day because this is what they do as interventional radiologists, and that they come up with that number. And if they say it's not a big deal and the cardiologist says it's really, you're fine, and the thoracic surgeon says, hey, it all looks great, then I just let it go that it's great. Who am I to decide that 40% sounds large? I mean, if I ate 40% of a cake in one sitting, that might be considered a lot. But when it comes to my health, sometimes you just have to defer to the judgment of the physicians and just let that part go. So when you hear how big your aneurysm is, it doesn't really mean it's big. It could just mean, you know what, compared to what based upon your size, your age, your body frame, what that size of your aorta should be statistically, you're, at the larger end of normal or just outside of that range. Just take it lightly, grain of salt. It's more important to understand, how are you going to monitor it and what your potential next steps would be when you hit a certain measurement. And that could take forever. It could take, I mean, think about when you find out what size your aneurysm is and you're this age, think how long it took for that to form. No one knows. Did it form in the last year? Did it form over the last 20 years? So you really need to kind of focus in on, okay, I have this aneurysm. So now what can I do to kind of prevent it from growing? What's the things I can do to be in control over my health as best as possible? Kind of like me and the coronary artery situation. So I think it's also really important that you ask about, what are the signs and symptoms of a rupture or a dissection? Because I know that's going to be a really big concern for everyone out there when they find out they have an aneurysm. What would lend me to go to the ER? So that's a wide range of questions and answers that are going to fall in there, because it seems to be that individuals that find out they have an aneurysm all of a sudden start feeling things that they may or may not have felt before, such as, I have shortness of breath. I'm having a problem swallowing. I have discomfort in my chest, but maybe you didn't have any of that until you found out you have an aneurysm. So that's where you have to kind of evaluate how you were feeling before diagnosis versus after. And is some of what you're feeling potentially more um, mental in the fact that it's drilled into your brain now that you have it? So are you really feeling this sensation, or are you feeling it because of anxiety, because you know it's there, which would be completely normal, totally normal. Um, and you want to learn what are some of the things that would cause you to have to go to the ER. And I'm not going to be the person that's going to tell you what those are, because your situation is going to be different. But would you go to the ER if you were having really high blood pressure? Should you go to the ER if you pass out? And that's not obviously something that's normal for you. What about chest pain? How long do I wait if it's lingering before I go? These are conversations you have to have with your own physician. And a lot of us learn by going to the ER instinctively because we just know this feels nerve-wracking, and then we're told, well, you actually have gas, you're okay, or we're told, I think maybe you pulled a muscle and you're okay. The the likelihood of having a dissection now that you've been diagnosed with an aneurysm is reduced significantly from those of us that didn't even know we had an aneurysm. And that's because now you're going to be followed. Now you're going to be monitored. Now you're on somebody's radar. So uh, I I would still want to know what the symptoms are I need to look out for that would cause me to go to an ER, generally speaking. I would not ask about how will I know if it's a dissection, um, as much as what causes me to go to the ER, because everybody feels dissections differently. There is no one definition of what you're going to feel. If I said to you, you're going to feel ripping and tearing in your chest, but maybe you just feel dizzy and, like you have reflux, that might not cause you to go to the ER when really you should, because maybe that was the moment that something's happening. So at the end of the day, again, talk to your physician and find out, is there anything that would cause me to have to go to the ER to make sure that everything's okay? And what would those feel like? Also, you might want to ask, how often do I have to have this aneurysm checked and monitored? And what would those tests be? I know a lot of people in the community feel that CT scan is the only way that you can get an accurate measurement, and that is simply untrue. Just untrue. It's not true. Echoes are one way that you can have an aneurysm in the thoracic area monitored. Now, really, the echoes, I think, are probably used more for taking a look at your valve. They do produce a measurement of certain areas in the thoracic area of your chest, but a CT scan is going to be your golden test, right? But that's because it's fast and it is accurate. You can get in and get out. The problem is that it does include radiation and a specific dye that there are many people that are allergic to the dye, so they have to be pre-medicated. And the alternative would be an MRI, which does have a different type of dye. It's called gadolinium, but that's typically tolerated by the majority of people. It's just that that test takes a lot longer. It can take about half hour, 40 minutes to do the entire aorta, your chest, your abdomen, and your pelvic area. It's still going to produce a really good picture. Now, here's the clincher. When you have these tests done, I also see in the community a lot of people will want to know, why are there varying differences in numbers? Did the radiologist get it wrong? Did the echo that said I was at 4.2, but the CT scan that says I'm at 4.1? Who's telling the truth? Who's getting the errors? What does this mean? You know what it means? Let your doctor read it and tell you what the total number is. That's my best advice. That's the best advice. Not because radiologists don't know how to read it, but some don't read it the right way. So you have to imagine, on your echo, you're trying to read something that is like in 2D. It's flat. So if you try to measure a tubular structure that's flat, and if you measure it diagonally, it's going to be a different measurement than straight across. It just is. And some of the measurements that they give you are actually the length of the aneurysm, and people think it's the width and they freak out. Don't freak out. Don't freak out. Don't freak out. Wait until your doctor tells you this is your measurement, if it's important for you to know. Some people are good with, you're good, we'll see you in a year. I would not be good with that. I would want to know a measurement because I'm kind of fanatical like that. But then when you've got your MRI or your CT, That's a different way of measuring also. Now, your surgeon should look at your scans and they're going to measure it the exact same way all the time. Technicians doing echoes or doing CTs, the technician A, between that person and technician B, might measure it differently. Some are from the inside points of the aorta, or one is the inside and one's the outside, or they're measuring outside to outside. There is a standard way of measuring these tests. In addition, if you're having a test done at a different facility than you did the last time, that could yield a different result. In addition, if you have a CT scan and one was gated, which means they've got some electrodes on you to determine your heart rate. I mean, not your heart rate, your heartbeat, to make sure they take a picture. I think it's in between beats, versus having a test that isn't gated and you're comparing apples to bananas, it's not going to necessarily give you the same result. So the rule of thumb that you can control is make sure you have your tests done in the same location over and over and over again. And you might not be able to guarantee you have the same uh, technician reading it, radiologist reading it. But again, at the end of the day, you just need to wait to hear from your physician to tell you if there's been a change or not. That's the most important thing. If you are somebody that needs to be tested every 6 months, with CT scans, there's nothing wrong with asking your doctor, well, could I maybe move to an MRI where I don't have to have so much radiation? That's a fair question. And they're going to tell you you're not really receiving that much radiation. But for certain people, for certain circumstances, any radiation is concerning. And that's okay. Have that conversation, right? Mm, but if you're asked to have an echo, it probably means that you have an ascending, a thoracic ascending, aortic aneurysm, and this gives them a chance to take a look at your valve to see if that aneurysm is impacting the valve at all. So that's one of the reasons why they may have you have an echo. But just ask what kind of test you're going to have and ask how often, and trust that process. Okay,
Hold on.
what are the risks? Oh, yeah.
Before I let you go, I just want to say we had in the support group somebody who was diagnosed with an aneurysm, and
Hmm.
he was a cardiologist that kind of found it, and it was like, yeah, we'll give you a scan in 2 years, and the flares from
Hmm.
the support group, the alarm on everybody's face,
Oh, yeah.
like everybody was like, well, hold on a second.
Yeah.
And this
Yeah.
gentleman is in his like early mid 40s,
Hmm.
and it's like I just don't feel comfortable with that. I feel like second opinion time, start swinging for the fences,
Yep.
self advocacy
Right.
for
First
sure.
thing I would do is I probably would say to my physician, I'm not feeling comfortable with that. I would prefer to have a follow-up test in a year. Let me see what it's doing in a year. And so the interesting thing is you can go a year, but it grew in 3 months, and you still won't know till you have the test done. But you can't have it. You have to have a reason to warrant a test every 3 to 6 months. If there's no growth, they are going to want to push it out. So, but I don't think I could ever live with waiting. Um, 2 years. I don't even like waiting 2 years on a colonoscopy, just because I'm so used to having so many Crohn's issues that the first time I heard they wanted to go 5, it just took my breath away. Um, so, and that's why probably it created some issues because then I got nervous and then I ended up having one sooner than later. But again, if a good team of doctors is going to listen to what you have to say and weigh in on your requests. Will you get another one in 3 months? Probably no, because there's no reason. There's been no growth that anybody can determine. But I would not personally want to wait 2 years. No,
And that's what
I'd
we all
ask
said.
for one.
That's what we all said.
Yeah.
We were like, you know what?
I can hear you all doing that. I can hear it. That's just terrible. All right. So, what are the risk factors for aneurysm growth or rupture, and how can I reduce them? And that is an interesting question. I'd love to hear those answers if you ask them, uh, because really the risk factor for aneurysm growth is typically, uh, one, it's going to be genetics. Because at the end of the day, this is just a human body. We can't really control everything our bodies decide to do. If you could, you wouldn't have had the aneurysm to begin with. So it's going to be genetics are going to play a role. Two, it's going to be your blood pressure control. It's going to be, are you bearing down or straining or lifting heavy weights and holding your breath as you do that, or any kind of exercise, really? So you'll find all of that out from your physician, and you should ask that question, as far as, do I have any restrictions too? That could help eliminate the chance for growth. And that's part of your how you can reduce them. Treatment options. So there's a lot of different treatment options for aneurysms, but it depends on where the aneurysm is and if it's impacting your valve or not. So you want to ask when the time comes, if this grows and it needs to be treated beyond the medication treatment that I might be prescribed now, what would be some of the other ways that we could fix this? I know everybody who finds out I have an aneurysm, it's 4.2, 4.4. I just want to get it fixed. I wish the world worked like that. It doesn't, unless you have certain connective tissue disorder, then it might work in your favor and you might be able to have it fixed. But these are hard surgeries. They're not easy. And so a physician typically wants to wait because statistically, waiting is still your better option, and you intervene when you are literally at the point and you have no choice. Counterintuitive. I hate it too. I know that you all hate this also, but that's kind of the way that it works based on statistics. So when you are going to have surgery, if it's open, they're going to do it at a time where, okay, now we need to do it. So if you're living with symptoms, if you have any, that they're going to push this to the last minute. But find out what the treatment options might be for you. Maybe you are a candidate for something endovascular. Uh, but that is a good question to ask. Uh, when you're getting to the place where you think you're going to need a procedure probably sooner than later, then you want to ask about how you can prepare for the procedure, if it's open heart or if it's endovascular, and what you can expect as far as recovery and what you can expect before it and after it. And what does recovery look like? And what will follow up care look like? I can tell you follow up care is going to be involving continuing monitoring. That's what's going to be like for the rest of your life. And how will having an aortic aneurysm affect your lifestyle, your diet, your exercise, your work, any additional medications? So, from what I remember, especially after talking with the disability attorneys, aortic aneurysm in and of itself is not a cause for going out on disability unless you have a job where you have to lift 150, 200 pounds every single day for hours on time. And that's what you're lifting. You have to be able to lift a person if you're in a certain medical career. I would assume that maybe that could be problematic. Maybe you're lifting luggage to get it in and out of a plane. And that could be problematic because, some of you ladies have really heavy luggage. I know I'm one of them. So there might be certain careers where having an aneurysm now has impacted your ability to fulfill the job requirements based on your restrictions. That doesn't mean you go out on disability. It means you hope your employer is one that can help find you suitable position in your workplace. It might mean finding another career path, doing something else. So there's probably special cases where an aneurysm has been cause for disability, but it's not something that generally happens like a dissection does. So it will probably impact your lifestyle a little bit. They're probably not going to want you to do like martial arts or football unless it's flag football. They're probably not going to want you to do, you know, competitive weightlifting, stuff like that. And if that's something that you're really into, something that they want to put a restriction on, you really need to have a conversation with that physician and see if you guys can work together to find ways to compromise, to retain the lifestyle that's going to bring you joy. Because there's nothing worse than having something taken away and now you're literally doing nothing. Well, that's not going to help the situation. That's going to create more stress, anxiety, depression, all not good things for your body systems. Would diet help? Diet always helps. Diet, diet, diet. We're always told about that. So it's going to probably be low sodium, if not, zero, if you can do that. And, obviously your fatty foods and greasy foods, all that's going to try to go bye-bye because that really does impact your heart before it would impact your aorta, although aortas can have some calcium deposits as well. But I would find out that information. Don't go all crazy like I'm going to cold turkey change everything because it's not going to be sustained, right? So make incremental changes and have a support system help you do that. And there are ways to alter your exercise so that you are accommodating your new health situation, but also accommodating what makes you happy. So These are some of the questions that you should be able to ask your physician to learn more about your aortic aneurysm. And it also changes depending on where it's located. You have the right to ask any questions that you have to get clear and honest answers from your healthcare team. Don't ever hesitate doing that. If you're in a situation where you're not comfortable, it's time to go find another team. And that's your Medical Monday.